To make a good nurse, I think that you have to be a great communicator, and that's not just talking all the time, that's listening as well. You've got a lot of active listening to do, so when you're sat with your patient and you're talking to them to try and find out any issues that they may have, try and let the patient talk to you rather than you always asking the questions, and just prompt them now and again. So it's a lot of active listening as well as communication, and actually the speaking part of it. And it's not just with your patients, it's with your colleagues as well, and that will be your doctors, your healthcare assistants, your other nurses, physios, OTs. It's all about multidisciplinary, so being able to communicate effectively to everyone to try and improve your patient's care. Not so much on the academic side of it, because to be a good nurse, okay, you need to have that knowledge there of why you do things, but it's not all about that. It's more about hands-on and actually getting involved with your patient, listening to your patient, caring for them, and actually doing the practical work. I know a lot of nurses that could be doctors, but they just don't want to be because they're more of a people's person, and that's what I think makes a good nurse. You need to be sympathetic and have empathy and care for your patients. You can't do nursing if you don't like it. There's no point, because it can be quite a stressful job if the ward's really busy and you're having patients being brought in from A&E because they're full, and you're having people going home. It can be quite a stressful job at times. So if you don't like it, there's no point doing it. You've got to care about your job to be able to do it well, as well as be able just to do it correctly.